Welcome back to West Texas View.
Just before the break, we were talking about early or late puberty, and so continue that conversation, and then you were getting into the menstrual periods.
Yes, a lot of times my job is just educating the family in what's normal, and educating the little girl too that this is normal to be developing breasts early or late. And a lot of times too, it's the stuff that she gets from her peers. You know, if you go through puberty particularly early or particularly
And the peers
late,
know more than the doctors.
Oh, yeah. And they're also harder on the kids. I mean, really, I don't think there's anybody that doesn't have trauma from being 13. It's an awful age.
I agree.
Yeah, it's just an awful age. But anyway, a lot of times I see people for heavy periods or abnormal periods too. I mean, it's awful to see a little girl that doesn't want to go to school the week of her period, or she's having so much pain that it interferes with her studies. It really does interfere with life. And I can remember myself being that age, being scared to death to stand up, thinking maybe I leaked through my clothes. And there are things we can do for that, and a lot of people don't realize it. Unfortunately, there's a bias that seeing a gynecologist always means a pelvic exam, and the majority of the time it doesn't.
And I thought that was so important, is that you try not to be invasive if you can keep from it. So you've got a lot of ways to treat them without the stirrups and the invasion.
Yes, and of course there's certain times when you do need to do that, and I always rely on the patient to say, look, we'll try this. If it's not better, come back. And there are some times where they kind of get the idea of, if this doesn't fix it, I won't come back. But it is very important to follow up and make sure, especially when I'm trying to be not invasive and not hurt someone, because there is a possibility of missing things, and so that follow-up is really important in that age group. And plus asking them whether they're having side effects from anything that I've done or any medications that I've given them. There is unfortunately a misconception that I want to talk about too, other than the whole idea of needing a pelvic exam to come see me. There is an idea that putting a girl on birth control pills will start them having sex earlier than they would have already. A lot of things that I treat are treated with birth control pills, simply because we can get a period down to 2 or 3 days and half the bleeding. So it's really a miraculous medication. Birth control pills prevent cancer of the uterus, prevent cancer of the ovaries. They're wonderful to be on. Frankly, it should be in the water, and it's a whole heck of a lot safer than being pregnant. At any age, even the old school 1950s birth control pills, still safer than being pregnant. And there's a misconception about that. Women do not choose to become sexually active based on contraception. They choose to become sexually active because they think that they're ready for it, whether they are or not.
Their glands are active.
Right. Other things are active, yeah. Or they're in love, or they think they're in love. And it's a combination of those things. So, you know, it's like we were talking about earlier, you know, having car insurance doesn't make me want to go out and get in a car wreck. And there are things that hopefully, even putting a little girl on birth control pills or an adolescent on birth control pills, that opens up a conversation a lot of times. And
besides, when you prescribe birth control pills to a little girl, because of, you don't necessarily say this is birth control pills. You say this is I usually use a pretty cautious way of talking about that. I say these medications are used to prevent from having a baby, and this is, and I give a brief explanation depending on the person and what they want to know, how they work, that they're not causing an abortion or anything like that. However, I say, I hope that you'll come to me and talk to me before you start becoming sexually active. Even if you feel like you can't talk to your family, you can always talk to me. I've had patients Facebook friend me and message me, which is fine. I don't have a problem with that. I'm on Facebook. And my patients from private practice in Tennessee still message me sometimes too. But it's actually a really good way to get a hold of the patients and to have them tell me things that concern me. And I've had some girls confess things like sexual abuse. I've had some girls talk to me about things that they didn't talk to their family about. And I also take that opportunity to talk to them about career planning, wearing seat belts, having vaccines, when do you want children, what do you want to do with your life? I mean, it's a moment of pride when one of my kids that I've taken care of graduates college. And I have a collection of, you know, college graduation announcements. So there are other things that I talk to them about too, and the very minority of it is becoming sexually active, because I think you need to be a well-rounded person before that happens, and I think a whole person, otherwise you can break your heart pretty easily. But the other side of that is that it gets those young girls used to going to the doctor, taking care of themselves, and asking the questions about what do I do, or what does this mean, or how do I take care of this? So at an early age, they should be very comfortable with going to a gynecologist.
Absolutely. And we usually, I would recommend starting to see one around 14 to 16 and reinforcing to that daughter that, they're not going to do a pelvic exam unless something's going on. And then as a parent, step out of the room. I realize that that is hard to do, but you will never find out what's really going on with that adolescent when you're in the room.
Yes,
And a lot of times I can get things out of them that you'll never know, and that I'll try really hard to get her to talk to you about. That's my job, is being an advocate for the adolescent and sometimes translating for the parent too. And as a mother, I pray and hope that I have the strength when my daughter's 13 to 16 to step out of the room. I really hope I do.
Give her space to come to her own.
To give her space to become an adult. And that's what they need, is the protection of a family member still there. So.
Well, one of the areas, though, that we talk about with adolescents, but you're talking about going way down younger, much younger than that, to care for children. So what is the youngest that you might be seeing?
Well, I saw a newborn. There was a newborn that had an anomaly on the outside of her bottom that was rather scary to the parents, I think. But sometimes little girls, little newborns that are born, have their mom's estrogen still inside of them. And so little teeny tiny skin tags can kind of grow from the estrogen and look scarier than they are. But a lot of times we get consulted for that sort of thing. And that's an easy visit. That's a, hey, look, I'll look at it in 6 weeks after the mom's hormones wear off from the newborn. Another thing that we see in newborns too is little girls will have a little bit of pink in their diapers. They'll actually get a withdrawal bleed, kind of like a mini period, when they're delivered. So it's not unusual for a little girl to have a pink streak in her diaper from having been born. Interesting things as the mom hormones wear off. But some of the things we see too are vaginitis in little girls. And that's, again, a really easy solution 90% of the time. And doesn't involve a speculum.
And it's usually hygiene.
Yes, usually hygiene, and that's the easiest thing. Very actually satisfying to fix. There are very rare times where we need to talk about taking a little girl to the operating room to look with a camera. There's a little teeny tiny camera, even narrower than a pencil, that we can put up inside to make sure that there's nothing up inside to cause a problem. And that, again, doesn't cause her to not be a virgin or change anything externally, doesn't cause any tears. Her bottom looks exactly the same before versus after. And again, not an invasive thing, no cuts, no nothing, but still intimidating for the patient and for the mom.
Well, there's a lot more I need to talk to you about. We're going to have to take a break. We'll be back in just a minute and continue this conversation.
Stay tuned. West Texas View will be right back.